is Alex Lee, and this is my proposal to optimize the incidence angles upon surgical insertion of vascular grafts. So I want to create an algorithm that will allow a user to pinpoint the ideal incidence angles when surgically inserting a vascular graft. Some background. After interviewing some surgeons at the Barnes-Jewish Medical School, I found out that the current standard of practice when surgically placing grafts between vessels is to eyeball the amount of graft to cut and to eyeball the ideal geometry. While decisions made from experience may be acceptable if a surgeon or practitioner is well experienced and a veteran, a less experienced surgeon could be left to fail before they can succeed. Additionally, the lack of scientific backing and mathematical decision-making when making these decisions is something that can stand to be improved upon. In a world where every decision and job is steadily moving towards perfection and machine-like automation, this is a relatively simple problem that deserves to be solved. A less than perfectly placed graft could result in failure of the graft, or even worse, rejection of the graft by body. These consequences are costly to fix at best and fatal at worst. So the way that I plan to solve this problem is to use the fluid dynamics modeling software, Fluid. In the software, we can model the approximate conditions of the vessels that will be connected by the graft and solve for certain properties. The vessels will be modeled as two long cylinders for the sake of simplification. So variables include the locations of the two vessels, the pressure, as well as the fluid velocity within the vessels, the cross-sectional area of each vessels, and then finally the approximate location of one end on the graph. Conditions that must be met include that the distribution of flow cannot be skewed beyond a certain point. This means the insertion of the graft cannot drastically alter the flow rate going through the artery, such that the artery will continue to function as normal. The optimization function. We will determine the optimumness of the solution by comparing the amount of turbulent flow within the final system with the graft placed. We will want to minimize backflow, which is when blood swirls around and does not go in a straight line as desired. This backflow can result in thrombus generation and imperfect flow conditions, which will greatly affect the efficacy and longevity of a graft. This backflow can be seen as synonymous with turbulent flow. Now, if this problem can be solved, it can become modeled and programmed. And then if the user interface becomes easily usable, it can be taught, and a trained technician can be present in the operating room with a computer, ready to tell the surgeon what angle of insertion is ideal, based on parameters that were already obtained because they are non-invasive. The location and size of the vessels can be determined with fluoroscopy and X-ray imaging, and the fluid velocity can be determined from the patient's blood pressure. All of the non-invasive parameters are quite appealing. This could potentially help a lot of people.